Public health announcement. This is my public health announcement. So this article came out today about Orange County, California. And so let's go through it. This is really challenging. You can read the headline: Mask mandate returns to Orange County Wednesday. Anybody who knows how Orange County has been handling the pandemic since it started means that we're going to have more of these protesters out there getting sick and transmitting it. We're going to have more from Peggy Hall. We're going to have more from Lenka Coloma. We're going to have more from the insurrectionists and the idiots that were protesting in Huntington Beach. So here we go. Mask mandate returns to Orange County Wednesday. Today is Monday. So why wait? Why not just, why? Why wait? By Spencer Custodio. This was published 5 hours ago. Beginning Wednesday, all Orange County residents will again have to wear masks when going to indoor public places, as the Omicron COVID-19 variant is raising concerns from public health officials, with some saying it will fuel a winter surge. We've already known this was going to... Governor Newsom, just a few weeks ago, already said he was expecting a surge. Why are we so slow to respond? I just don't even get it. The California Department of Public Health, CDPH, is requiring masks to be worn in all indoor public settings, irrespective of vaccine status, for the next 4 weeks, December 15th, 2021 through January 15th, 2022, reads updated health orders from the state health department. So you're going to also stop indoor dining again, right? And you're going to require these restaurants place their guests at least 12 feet apart, because that's how far apart they really should be if they're eating, because you project more moisture droplets when you're eating. Lord. The month-long mask reinstatement comes as a new variant, Omicron, was just discovered Thanksgiving week in South Africa. And just for clarification there, just because it was discovered in South Africa does not mean that's where it originated. That's where the scientists who happened to catch it first, to not, physically catch it, but discover it first, found it. It doesn't mean that it originated there. It means that those scientists were the fastest to figure it out. The variant is already fueling a surge in the United Kingdom. Public health expert and UC Irvine, University of California, Irvine. I don't know why. Look, if you're going to halfway acronym it, either spell it all the way out or just call it UCI. University of California, Irvine epidemiologist Andrew Neumer said it's now certain Orange County will face another winter COVID surge. You're saying this like we didn't know. We knew. Omicron is going to guarantee the winter wave, whereas before it was only 90% sure. It was only 90% sure. Okay. Neumer said in a Monday phone interview, there's going to be a big winter wave. How big, how deadly is anybody's guess. The California Department of Public Health's updated health orders note wearing masks significantly reduces COVID-19 transmission. Implementing a universal masking requirement not only has proven to decrease the rate of infections, but is able to slow community transmission. A series of cross-sectional surveys in the U.S. suggested that a 10% increase in self-reported mask wearing tripled the likelihood of slowing community transmission, reads the department's website. This is another reason it really makes me nervous. It infuriates me when people try and peer pressure me into taking my mask off. County public health officials have said Omicron hasn't yet been detected in Orange County. Well, then what the hell are you doing to detect it? Because last I read, just a couple days ago or something, they have already detected it in the wastewater in LA County. So what are you doing to test our wastewater and see? We're literally the county next door, and you're saying, nope, we haven't found it yet. Why not? You should have found it by now. Some public health experts fear the new variants may resist the vaccines more compared to previous variants like Delta. God, they're acting like Delta's already gone. It's not even fucking gone. Can't even. Neumer said it's too early to definitively say how it will affect vaccination efforts. Well, okay. I thought I already read earlier today that, or maybe it was on Kaja and Niles' show, that they were talking about something that they had read about the prediction is that we would have the vaccine booster to cover Omicron somewhere by like March. By the time we get these vaccines out, there's new variants. You motherfuckers need to start wearing masks. This is so crazy. All right. Basically, the unknowns outweigh the knowns at this point for Omicron. So yes, the existing vaccines aren't worthless. Of course not. But we can't... God, wow, you wrote this really... Oh, no, that's a quote. That's a fucking quote. Wow. But we can't rule out that we'll have to make a new vaccine tailor-made for Omicron. Well, yeah, you're not... I mean, come on. Dude, that's already in the news. That's already in the news. Come on. Why are you saying stuff like that? All right. But the thing is, that only paves the way for another variant, too, he said. Oh, God, who is this? Wait, who is saying all this nonsense? Who is being quoted? Andrew Neumer. Dude, Andrew Neumer sounds like a freaking anti-mask or an anti-vaxxer. Meanwhile, Orange County's positivity rate and hospitalizations have plateaued since Thanksgiving. Well, I guess that's good. I would say right now it looks like transmission and hospitalizations are a little bit steady, said Vladimir Minin, a UCI. See how they did it here? This is better. Like I said, you go one way or the other. You don't do both. UCI statistician. That's a tongue twister. Biostatistician. I don't know why that didn't want to pop out of my mouth. Vladimir Minin, a UCI biostatistician, who's been tracking COVID-19 trends since the pandemic hit last year. As of Monday, 196 people were hospitalized, including 66 residents in intensive care units, according to the county healthcare agency. The virus has now killed 5,823 people, more than 5 times the flu kills on an average 2-year average. Sorry, I did a little dyslexia there. These, by the way, that 5,823, that's Orange County. That's an Orange County number. That's how many people we've already lost in Orange County. Orange County has averaged around 20,000 deaths a year since 2016, including 543 annual flu deaths, according to state health data. So that basically what the author of this article is pointing out to you is that COVID represents more than 1/4 of the total deaths in Orange County at this point. While the county's pandemic metrics have remained stable, state officials have noticed an increase throughout California. You know what, though, there are some of us who were really watching the numbers on the OC Health site for at least like the first year, maybe more of. I think some of us kind of dropped off watching the daily numbers when we started getting vaccinated because we had at least the confidence that we wouldn't die anymore. Like, it took a lot of the anxiety out of the situation, that we didn't have to worry about like ending up on a ventilator unless like something was seriously wrong with us in the background, right? Since Thanksgiving, the statewide 7-day average case rate has increased by 47%, and hospitalizations have increased by 14%, reads the state health department website. So that's the state. I feel like it would be very difficult for us to be living right next door to Los Angeles and not have this as a pretty widespread virus already in Orange County, especially given how many anti-maskers live in our county. I just find that impossible. So I really do have to question this dude. You really have to question Neumer for being like, no, it's not here yet. It's not here yet. Like Neumer, Minin also said it's tough to predict how Omicron may affect the local pandemic landscape. Like, what does that mean? Oh, okay. There's a quote. Every geographic region will experience Omicron differently depending on the types and levels of immunity, Minin said, noting infection differences for people with natural immunity compared to vaccinated immunity. You already saw like how the death rates are really spiking in the Trump supporting counties of the country. I always felt like that dude was just full of it and he was a disruptor and he was just using Republicans, and now he's literally like encouraging them to die. I mean, he has been for a couple of years now. And he said scientists still aren't clear how it will affect hybrid immunity, which means people who've had COVID are now what? Wait, let me read that again. Okay, all right. So it's explaining the hybrid immunity that was in quotations. And he said scientists still aren't clear how it will affect hybrid immunity, which means people who've had COVID and are now fully vaccinated. I've already seen stuff on that. Like, what's going on with Orange County that I know more about what's in the news than you do? They've already come out with news, I can't remember where I saw it, but I saw it today, that said that statistically hybrid immunity, being vaccinated through actually contracting COVID, does not protect you nearly as much as actually getting the vaccine. And in fact, you're probably at a lot of risk because you feel so confident and, well, I just had it, I can't get it again. We literally saw the first case of somebody get it twice within 2 months of them saying, like, that it was out there. Of course you can get it again. Another variable, Minden said, is booster shots. It's hard to compare right now because Omicron is spreading in different countries in very different contexts, he said, noting that the variant spread in South Africa is different because they have less vaccine coverage compared to the UK. Before state officials unveiled the reinstatement of an indoor universal mask mandate, Neumer urged people to mask up. God, okay, because it kind of sounds like you're putting doubt in vaccines at this point. But maybe that's your shtick. Maybe you're like my former project partner who does the same bullshit, tries to scare everybody off the vaccines and say, you have to mask, you have to mask. Well, of course we have to mask. We have to do both things. If you're just wandering around the sweater section around Macy's, like what kind of, oh my Lord. Okay. This is actually like a high ranking person at the Orange County. I can't even. All right. If you're just wandering around the sweater section around Macy's, it's just not clear. There's a huge bonus to being unmasked. Wait, what? It's just not clear. There's a huge bonus to being unmasked. This is so weirdly phrased. This whole, like every quote coming out of this dude's mouth is so weirdly phrased. Therefore, I would recommend masking, he said. This is really dancing around the subject. You're supposed to be a health official, right? Why aren't you just telling these fools that we still need to wear masks because the virus keeps mutating and it's still not safe because you can become a transmitter or you could end up having complications that still put you in the hospital. Your likelihood of dying is less, but I mean, why can't you just say it like it is? At a news briefing last Friday, Deputy OC Health Officer Dr. Regina Chincio Kwong also said county public health officials are still learning how Omicron can affect the pandemic's trajectory. As we all know, scientists are still learning more on how Omicron spreads and infects people, Chincio Kwong said. We're hearing from overseas that it's highly transmissible. We're seeing this in Europe and in South Africa. Yet, in talking to reporters, Chincio Kwong also indicated that the Orange County officials had no taste for mask mandates. Oh, for fuck's sakes. These are our health officials, you guys. This is what we have to deal with in Orange County, California. These are our health officials, arguing in their view that the approach generated significant polarization. I don't care if your butt hurt. I don't care if your feelings are fucking hurt. God damn it. You're the health officials, and you have to rise above the politics of Trump's dumbass followers. QAnon bullshit people. Nonetheless, she told reporters that HCA officials are urging people to wear masks when going to crowded indoor spaces. Oh, she's narrowing it down even further. Shut down the indoor dining. Shut down indoor dining and send people to work from home again. Stop letting these businesses call everybody back into the office. Wearing that mask is a really good idea, Chincio Kwong said. It's a really good idea. You guys are the weakest health officials fucking ever. You're the weakest health officials ever. Wearing a mask is a really good idea. We can't really predict all of these things, but again, using caution is the best recommendation I have. This you are employed to keep the county healthy and safe, and you can't just lay down the law with these. You know what they're afraid of? They're afraid of that first doctor that we had in charge. She had to resign because she was getting death threats. These folks have literally won't do their jobs properly anymore because they are scared of the Nazis that are terrorizing them, that live in Orange County, or maybe they don't even live in Orange County. A lot of these crazies get bussed in from other places for demonstrations, to demonstrate, to be public disruptors, to show up to the city councils, to show up to the board of supervisors. They're not all locals. We've seen this before with the amicus briefs back in 2018 when all the city councils in Orange County were trying to pass the amicus briefs so they could join the county's website against the state for Kevin De Leon's legislation to create sanctuary cities. Spencer Custodio, I hope I'm saying your name right, is a Voice of OC staff reporter. You can reach him at scustodio at voiceofoc.org. Follow him on Twitter. I might start actually following you, dude. And then you can buy some swag. Wow. These are our health officials, y'all. And they can't even, they're lacking so much courage. They either believe this and are being sincere about it, and so they're clearly like should not be health officials, because they're like positioning this as something that would be palatable to anti-vax, anti-mask crazies. Oh, this is okay. I'm not going to read the ad. I think that's it, though. That's it. That's the whole thing. That's the whole thing. Okay, so start enforcing it. Start enforcing the mask mandate. Don't just tell us there is one. I've been to so many indoor buildings at this point where people are refusing to wear their masks. You have to tell them to put their masks on and why, and stop dancing around the subject.